Good afternoon. This is County Executive Barry Glassman. I want to welcome you to our Zoom call this afternoon to talk about prescription drug costs. We are so pleased today to have the chairman of the Prescription Board, Affordability Board, Van Mitchell, with us, and some colleagues of mine that have worked so hard throughout the state to bring attention to the struggle that many of you are having with affordability and your prescriptions. I know that the bill that passed the legislature also deals and helps with local governments. As your county executive, Harford County spent last year close to $13 million alone in prescription drug costs. And of that $13 million, about $4 million for 82 prescriptions were for specialty drugs. And so you can only imagine that's almost a quarter of our cost just in those specialty drugs. And that's for 80 employees. And so local governments throughout the country and Harford County, I had a chance to look at some of the averages over the past week. And each year we have been absorbing from 10 to 12%. In fact, last year, our cohorts had an average increase of 12.2% over the prior year. So you can see how that cost, even for local governments, and to provide prescription plans to our employees, our retirees, is becoming more difficult. And particularly for you, our families in Harford County, our senior citizens, I can only relate to what that is doing to your family budgets. And as my good friend Vinny DeMarco always says, and many of my colleagues, that prescription drugs do not work if you cannot afford them. And so our work with the Prescription Drug Affordability Board is to bring attention and get out into the community so that we can talk about and find solutions to these increases. I would note that here in the fall, we will be working together. Last year, there was a bill to bring a practical funding mechanism to help fund the board's operations. And unfortunately, the governor vetoed that bill, but we will be asking the legislature to override that bill so that we can enable the board to do its work and to be funded and staffed properly. And so I just want to thank everyone for signing up. Make sure if you have questions that you'll be able to ask your questions or fill out a questionnaire to get in also. So it is my pleasure to introduce Vinny DeMarco, who has spearheaded this effort for us for some time. And he is dynamo. I wanted you to get to meet him in person because he is a force unto himself. But we're going to talk to him and have him visit us here by Zoom. And Vinny, thank you so much for bringing this together and bringing the panel to Harford County. Because I always tell folks, no matter whether in Western Maryland or the Eastern Shore, Democrat or Republican, when you go to a pharmacy to pay your copay, they don't ask you if you're Democrat or Republican or where you're from. You have to come up with substantial copays. And that's important for everyone to know that this issue cuts across many families, different registrations, geographical regions. And so it's important that we all come together to find a solution for these rising costs. So Vinny, I'll let you take off. Thank you so much for joining us.
Well, thank you, Mr. County Executive Glassman. I just want to say that we are thrilled to be here with you virtually. We wish we were in beautiful Harford County in person, but in this COVID time, we have to do this virtually. In 2019, with a lot of help from County Executive Barry Glassman, who was one of our key leaders, Maryland became the first state in the nation to create a prescription drug affordability board. You're going to hear soon from the lead sponsor, Delegate Joseline Peña-Melnyk, and our leader in the Senate, Senator Brian Feldman. We're going to talk to you a little bit, but I just want to thank them and the Maryland General Assembly so much for taking this lead. Since we passed this law, over a dozen states have asked us how they can replicate it. We've been going around all around the country advising people how they can take this Maryland model home to them. So it's becoming something the whole country is trying to replicate. And we are thrilled that 5 wonderful people were picked to be on the board, including the chair that we're honored to have with us, former Health Secretary Van Mitchell, who is an exceptional public health advocate and leader, doing a great job with the board. But that board is doing a great job, and we are thrilled that we're leading the country here with this prescription drug affordability board. What we've been doing since the board law has been enacted is holding forums across the state so that people could hear about what the board's doing, and so the board could hear from you about how high-cost drugs are affecting you and hurting you and your families. We did 2 of these live in Howard County and Baltimore County, which went very, very well. And of course, we had to stop the live ones since COVID. We had one virtual one in Charles County, which went very well. This is our second virtual forum. We have other ones planned in Frederick County and Baltimore City. We are going to hear from the leaders I've spoken about and others in a couple of minutes, and then we're going to give you an opportunity to answer, to ask questions of them. But we also want to hear from you, how are high-cost drugs hurting you and your families? And you all should have gotten by email, and it's also in the chat, a link where you can give your input to the board. This is very, very important, ladies and gentlemen, because the board's charge is to make prescription drugs more affordable for Marylanders. We're thrilled that County Executive Glassman has provided such wonderful information that convinced the legislature to enact this law, and also that the board can use to see how high-cost drugs are affecting and hurting county governments. But we need to hear from individuals like yourselves. So all of you listening, if high-cost drugs have hurt you, tell us how. Respond to that form. You could do it anonymously or with your name, and that the board will listen to that information. So with that, I want to introduce our first speaker after County Executive Glassman is our wonderful lead sponsor, whose name is on the bill, that is now a model for the whole country, as her name should be, Delegate Joseline Peña-Melnyk, who represents Prince George's and Anne Arundel counties. And as I say all around the country, you got to find a Joseline Peña-Melnyk if you want to get this done. She is a terrific public health leader and fighter, and we'd love to hear from you, Delegate Peña-Melnyk.
Thank you, Vinny. I really appreciate your leadership, and I couldn't have done this without the help of Senator Feldman, who's right here, who was my counterpart in the Senate, and Senator Klausmeyer. But Senator Feldman defended the bill on the floor and has been a true partner. And people like AARP and Larry and our wonderful county executive, Barry Glassman, thank you for your leadership, for working in a bipartisanship manner, which really matters. And all our partners, they helped us. So I put in this bill in 2019, as you heard, and I put in the bill because there were so many people that we heard from, and you will hear from Larry today, that were really having a difficult time in paying for their medicine. So they were making the choice between paying for their rent, paying for their mortgage, buying their medication, buying their food. And that is not right, not in a country like this, not in a country like ours. So I put in the bill, and the bill actually created a prescription drug affordability board, like you heard. It is an independent body that has the authority to evaluate expensive drugs and to make recommendations, appropriate methods of addressing cost. So it has some power. It is independent of the legislature, and it's supposed to come up with recommendations to make drug affordable for you and for everyone else in Maryland. We have 6 million people in Maryland, 24 jurisdictions. So we do care, and we do hear you, and you do matter, and your voices were heard. So thank you so much, Vinny, for giving me the opportunity to be with you today. And thank you so much, County Executive, for allowing us to be in your beautiful county. Hopefully when this is done, COVID, we can come and visit. And I do appreciate all the partnerships of everyone here involved. Thank you so much.
Thank you, Delegate. And as Delegate said, one of our key leaders in the Senate was Senator Brian Feldman, who fought for this bill hard. It was not easy. A big pharma fought it tooth and nail, and it was hard to get it through the Senate, but Senator Feldman did it. He's a master strategist and a great public health leader whom I'm proud to call a friend, and I'm thrilled that he's here with us. Senator Feldman.
Well, thank you, Vinny, and it's great to be here with Delegate Peña-Melnyk, with Van Mitchell, and your great county executive here in Harford County, Barry Glassman. Let me just start by saying, you know, the bottom line is, and I'm not muted, right?
No, we hear you.
Okay. The fact is, Congress, this should be something that the United States Congress takes up, but they have really done nothing. And so it's really up to the states. And so where Maryland came down a couple of years ago was, we made a decision we want to lead the country amongst the states. And we passed a prescription drug price gouging bill that passed, was first in the nation, got struck down by the courts. And then we went back to the drawing board in 2019 with the leadership of Delegate Peña-Melnyk with this legislation to create this board. But the fact is that as soon as this board was created through the legislation in 2019, we've been fighting with the governor to try to find the way to fund the board. From the get-go, we created the board. We thought the governor was going to use general funds to let the board do its job, but the governor didn't do that. And so we had to go back, and the board had to go borrow some money. And this year we decided in 2020 to basically put in place a permanent funding stream so we wouldn't have to go back and forth every year fighting with the governor. And so we did create this very, very modest fee of about $1,000 on a lot of entities to create a fund that would, again, fund the operations of this board for the first couple of years. And to our shock, the governor vetoed the bill. And the reason it was so shocking was there was no opposition to the bill. Nobody testified against the bill. And in the floor of the Senate, the bill passed unanimously. Not a single senator, Democrat or Republican, voted against this funding source bill for the Prescription Drug Affordability Board. And in the House, overwhelming majority passed the bill. And so it was an odd veto. All it would have done was let the board do its job, pay back the money it had borrowed, and then fund it for the next couple of years. And so I'm very confident when we get back in January, when the first orders of business will be to override that veto and let us move forward. And again, as Vinny mentioned, the first state in the nation to create a board like this. And again, it's a great team effort. I'm very proud of having been part of it. So with that, I look forward to the Q&A, and back to you, Mr. Moderator, Vinny.
Well, thank you, Senator, again for your leadership. I want to emphasize something Senator Feldman said. Both these bills, the 2019 creating the board and the 2020 bill, the funding mechanism, were bipartisan. And we had Republican county executives like Barry Glassman and Democratic county executives from across the state behind them, and Democratic and Republican legislators. This is not a partisan issue. This is a people of Maryland issue. I want to emphasize that. And I didn't say it at the beginning, but I'm thrilled that over 110 people have signed on to be part of this virtual forum, and I want to thank the county executive and his wonderful staff for putting all this together. Now it's my great pleasure to introduce Van Mitchell. I've known Van for many, many years as a terrific legislator and one of the best health secretaries Maryland has ever had. And I was so thrilled when it was announced that he was going to chair the Prescription Drug Affordability Board. And just as I thought, he is doing a great job. And we're thrilled he's here with us. All yours, Mr. Chairman Van Mitchell.
Thank you very much, Vinny, and thanks to Senator Feldman and Delegate Peña-Melnyk. Barry, always good to see you. We are very excited. We obviously were hoping that our bill was going to passed completely last year, but as the senator and delegate said, we got a little more work to do. We have been in the organizational structure, as I tell people, getting to know each other. We have 5 board members. We have a contract employee now in place, which has been a big help to me. And we just closed out the advertisement for our executive director. So hopefully before Thanksgiving, we'll have a big announcement to make in regards to that. We have gotten our website up and running, so please visit that. I think we'll probably have it up on the screen, but it's pdab.maryland.gov. We have had 5 or 6 meetings so far. The last 2 have been virtual. Our next meeting, and we hope that you would tune in, is going to be November the 16th at 2 p.m. That is virtual, so please go on the website, register for it. The board is very much interested in hearing what you have to say. We are going to be working with MACO closely and with the state retirees and with the General Assembly. So we look forward to the upcoming session. I do think the board is now organized. They understand what their role is. We are making some progress with office space and the likes of that. So we look forward to a very productive year in 2021. Vinny?
Thank you, Mr. Chairman Mitchell. As you saw in the chat, we did put up the website for the board and the website on our website, healthcareforall.com/RX input, where you put in your stories of how high-cost prescription drugs are hurting you and your families. And as the chairman said, the board is very interested in your input, so please give it. I would be remiss if I didn't thank our wonderful Deputy Director at Healthcare for All, Catherine Kirk-Robbins, who's done so much to organize all of this. Thank you very much, Catherine. And our success would not have been possible without a broad coalition of over 400 faith, community, labor, business, and healthcare groups, from the NAACP to unions to faith groups and all across the state. But nobody did more than AARP Maryland. AARP Maryland was there from the beginning, fighting for this law and making it a priority for their 800,000 members who really will benefit from its success. And we're thrilled that at these meetings, we've had a terrific representative from AARP who really knows his stuff and represents AARP wonderfully, Jim Gutman. And Jim is here with us again. All yours, Jim.
Thanks very much, Vinny, and it's great to be here. For AARP and its approximately 862,000 members in Maryland, age 50 and above, prescription drug affordability is a very high priority. Those Marylanders in that age group are the largest users in the state of prescription drugs. They have an average of 4 to 5 prescriptions at a time each. And those prescriptions, as everybody here knows, are becoming increasingly unaffordable, especially specialty drugs, as your county executive noted, but also orphan drugs, drugs for which there are no competitors, are among the biggest problems. And the best hope for doing something about that in the next few years is having a fully staffed and funded prescription drug affordability board. Toward that end, AARP Maryland and its allies are very active in looking to overturn the governor's veto, and we'll support that in the upcoming session. And I just want to emphasize that this legislation would not cost taxpayers any money whatsoever. It's done via fees on others in the chain of the drug benefit. You've heard a plea for stories that we can use in our campaign to do something about it. I hear a lot of stories myself in my capacity as a volunteer Medicare drug plan counselor each fall, and I'm hearing that again in the open enrollment period. But I can't use those stories because they're all confidential, and we always protect the confidentiality of people. So we really need to hear your stories and have the legislature hear your stories for this issue. As your other speakers have said, the PDAB is an excellent body. I've listened to a couple of the meetings. They really got their attention on the right issues, and we look forward to working with them in this year and in the future. Thanks.
Thank you very much, Jim. It's a pleasure to work with you and AARP. As Delegate Peña-Melnyk said, one of the most important influences to the legislature with people who told their own stories. And nobody tells their story more eloquently than our next speaker, Larry Zarzecki, who's before every committee has so eloquently told how high-cost drugs have hurt him. I think it's had a tremendous impact, and we're thrilled that he's here with us today. So let me turn it over to my good friend, Larry Zarzecki. Larry?
Hello, everybody, and thank you for having me today. I'd like to start off by saying my name's Larry Zarzecki, and I suffer from a neurological disorder where my body doesn't produce the dopamine or the dopamine needed to allow my body to function doesn't live long enough. I spend out of pocket so far this year, I've gone into my IRA to the tune of $7,000 to make ends meet. So I legitimately fall into a category which is known as eat, heat, or treat. And it's not a position that at my age I would have ever thought I would find myself. But unfortunately I do, and I do the best I can. And what I would like to do is I would like to thank each and every person with the coalition, and I would like to challenge everyone who's listening but is a little hesitant of telling their story. Please believe me when I tell you, Delegate Peña-Melnyk, Senator Feldman, Mr. DeMarco, Chair Mitchell, Mr. Gutman, County Executive Glassman, they all take this very seriously. And had I not seen it with my own eyes and been to a lot of these meetings, I would have been like everybody else, or the majority of people that thought, well, it is what it is. Well, it's not. These people care. They've actually gotten the attention of the national level, and it's just incredible. I admit I was one of the 29% of the people that failed to take my medication in the beginning on time. And I also skipped some medications. That was not good. It just created my symptoms to present in a more negative way. So with that being said, I spend about $3,000 a month. I've gone into my IRA this year, $7,000. Now this is $7,000 that I'll have to pay taxes on next year. So I think that's something that a lot of people just shake their head at when they realize, hey, I'm going into my IRA. So my prescriptions are a little over $3,000 a month now. And I'm going to borrow my little camera here, and let's see if I can get them here. But here are the 10 prescriptions that I take daily to function. The most expensive medication that I take is the EpiPen that you saw. The EpiPen itself, I have a copay of $250 on that. And that regularly goes under review where I go without it. And that's one of them, along with the carbidopa, levodopa that I really need. So 29% Americans failed to take their medications as prescribed because they can't afford them. People, I challenge you, please help me, help yourselves, save a life. It may be your friends, it may be one of your grandchildren, it may be one of your children. But everyone on the board deserves a big round of applause, and prices could not be under control and beginning to get under control the way they are without each and every one of you. And I thank you so very much. Mr. DeMarco.
Thank you, Larry. That was eloquent as always. Now everybody can see how his story helped to convince the Maryland General Assembly to enact this law. Thank you, Larry. And please take seriously what Larry has said. Your stories matter. Dan Mitchell and his colleagues on the board really want to hear how are specific drugs hurting individual Marylanders. Very, very important for you to fill out the form if you have such a story so we know it. So at this point, I'd like to turn to questions, and I see a couple people have questions up. I'm going to read the two that are up, and then we could answer them for you. One question I'd like to direct this to Chairman Van Mitchell. How much money was asked for to fund the board's work from Luann Brown?
Well, originally, in the original bill, there was a $750,000 fund that was going to come out of general budget. I believe the senator and the delegate had planned for 2 years. And then it asked the board, once the board was up and running, to find a funding formula mechanism to fund the board in the future. What we did when we got named and came in early was try to find $750 that the governor didn't put in the budget through the Maryland Healthcare Cost Commission, in which we said we would pay back and then move up 2 years, which the senator and delegate did, putting in the bill that would put a funding mechanism. And what we did was cap it to say that the board could not raise the fees more than $2 million. And we had set the fees to where they would be between $750,000 and $1 million the first 2 or 3 years, so that it didn't create such a burden to any one particular company or organization. We ended up spreading it up over 400 people or 400 firms that are currently licensed with the Board of Pharmacy in Maryland. So we felt like it was a very positive cost bill that would allow the board to move forward, but on a very minimal scale, and would not allow the board to raise a lot of funds just for the sake of raising a lot of funds.
Thank you. Senator Feldman, Delegate Peña-Melnyk, anybody else want to add to that?
Well, can I just say one thing? That I said earlier that the veto of the bill was really perplexing. One of the reasons was that the funds that would have flowed as a result of the bill would have allowed Van and the board to pay back the Maryland Health Commission, a state entity, $750,000. So at a time when we're struggling financially because of the pandemic, here was a mechanism that would have allowed the board to give back to the Maryland Health Commission, a state entity, $750,000, but the veto stopped that from happening. Again, another reason why nobody could figure out why the governor decided to veto the bill. In addition to the fact that nobody was opposed to the bill, nobody testified against the bill.
Thank you, Senator. Anyone else?
Yeah, it simply made no sense, right? It did not make any sense because it wasn't going to cost a lot, and there was a funding mechanism, and it was a bipartisan issue. I mean, it has support from both the Democrats and the Republicans. You know, the governor himself and Senator Feldman and I, we work for the state. Okay, if we choose to have the insurance from the state, we have great insurance, but not everyone has that insurance. So we were really perplexed that someone got to him to veto it, but we will, God willing, override that veto in January because it's simply the right thing to do.
Delegate, anyone else? Thank you for the question. I'm going to read the next one from Jack Pfeiffer. Is the Maryland Prescription Drug Affordability Board going to give serious consideration to expanding access and support for personal prescription importation from countries like Canada, where prices for the same drugs are regularly 50 to 90% less expensive than the U.S.? Before I turn it over to others who want to answer, let me just say one issue there is that requires federal approval. A couple of states have passed laws like that, but they're not being enforced because the federal government has to approve it, which they have not done. And so we wanted to enact something in Maryland that didn't require federal approval. Anyone else want to chime in?
No, I mean, Vinny, I think you said it, and I know Senator Feldman and Delegate understand this issue and have been working with it and been working with the Maryland delegation. I will just say from the board's perspective, we'll take the lead with the Maryland delegation and the senators and the delegates as to what they would like the board to do. That's what the board will be doing. The board will be constantly working with the General Assembly as to the direction that they'd like to see the board go.
Anybody else comment on that? Okay, next question from anonymous attendee. Have you asked for volunteers to work on this board? Let me just say the members, the 5 members of the board have already been picked. Chairman Mitchell, of course, and 4 other wonderful people, but I'm sure volunteers are always welcome to help. Van, all yours.
Yeah, I think once we get up and running, in the original bill, and I'm sure the senator and delegate will correct me, but I think there's a council that is somewhere in the neighborhood of 26 or 28 members, that they included a cross section of membership on that. And there are some, I believe, some volunteers on that as well. So that will be selected by the leadership in the House and the Senate, the Speaker and the President of the Senate. So I would say if anyone wants to forward resumes to the board, we can more than happy to send those in for them.
Anyone else? Next question from Luann Rao. Did the governor state why he vetoed the bill? I'll pass this on to everyone else. He did write a letter saying that he thought it was a bad idea in COVID time to have any kind of tax. Anyone else want to comment? Okay. From Karen Winkowski. And by the way, folks, these are great questions. Mr. County Executive, you have wonderful constituents in Harford County asking great questions. In addition to looking at the cost of prescription medication, is the board looking at issues like eliminating the coverage gap for Medicare beneficiaries? I'll turn that over to everyone else, but first of all, that would be something the federal government has to do if it's directly Medicare. Anyone else want to comment?
Well, I just wanted to say that in my doing drug plan counseling for the county SHIP, I see lots of people who get into the coverage gap, and unfortunately the states and federal subsidy programs just aren't enough to make up for that. So that's an area that really needs a lot of attention.
Hey, Vinny, can I just throw one other thing is, look, tomorrow's a presidential election. This isn't a partisan call. This isn't anything. But the reality is, whether it's on importation or this question that was just raised, fact is we do need a partner in the United States Congress to deal with these issues. The fact that we are creating boards and passing laws in 50 different, and by the way, other states are looking to Maryland as a model and are trying to duplicate what we did with this board. But the fact is, it would be great if we had a partner, and I'm hoping that after tomorrow we can get back and actually do some things in a bipartisan way in the Congress that can help all 50 states out in this on this very important topic. So, we've had a couple of questions where the answer is, yeah, well, this is great, but we need some cooperation from the federal government, whether it's approval or they have to pass a law or they need to do this or they need to do that. But they've been, again, asleep at the switch for a long, long time on this topic.
Thank you, Senator. Anyone else? Okay, great. I don't have any other questions. I'll give it a couple seconds for anyone else out there. Thank you all for listening. I just want to urge you one more time, please, 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 if you are being hurt or any of your family by high-cost prescription drugs, do what Larry did and tell your story, and it has an impact. Go to healthcareforall.com/RX input. It's in your chat. You could tell your story. I don't see any other questions. I'm going to ask the county executive to close us out, but before that, any other panelists want to say anything, Delegate? Feldman?
Basically, thank you. Thank you so much, all of you, for making time to join us today. You could have been doing anything else, and this was important enough that you join us. You have great leadership in your county executive. Again, this was a bipartisan effort. So we welcome your stories, and please check the website and participate, because all voices matter, and we do care. Senator Feldman cares, I care, our colleagues care, and Van is doing a great job. and you have people like Larry who are going the extra mile, coming to Annapolis, which is not easy, going through security, waiting for hours to share his story to make a difference. So please do so. And again, I thank you. Thank you so much, County Executive.
Thank you, Delegate, for your leadership. We do have one more question from Luann Rao. How can the board work with Congress to tackle these issues that go beyond our state? I'll turn that back over to Senator and Delegate, but let me first say that Majority Leader of the U.S. House of Representatives, Steny Hoyer, was part of our Charles County event. He is a big supporter of these issues, and he will work very hard, I believe, next year to get something good passed. But Delegate, Senator, or Van, anybody want to add something?
Yeah, well, I think having Leader Hoyer as a Marylander that's a great pipeline. Also, I'd make the point that former Congressman Elijah Cummings was very much out front on this very issue. So we have a brand in Maryland that we want to be out front. And quite honestly, some of our federal members of our federal delegation have been out front. You know, unfortunately, nothing's happened up there, but I think Congressman Hoyer is a good sort of partner and has been. And I think that's a starting point to get, you know, some collaboration between us and the Congress.
Great. I see no more questions. Anybody else want to say something before I turn it over to the County Executive to close us out? Okay, thanks, the wonderful panel. Thanks for the people with your great questions, and hope you all who have stories tell us your stories. Mr. County Executive, you want to close us out?
Sure. I want to, first of all, thank everyone for listening in. Please email me at btglassman@harfordcountymd.gov. You can share your story with me here at the county, and I can make sure I can get your story back down to Annapolis. And you can see the great partners we have here from the House and the Senate, Vincent DeMarco, Larry, and Van, AARP, everyone that's worked so hard on this legislation. And listen, we are, I hate to say, we're not really pipe dreaming here. We realize this is a difficult battle yet to do. We're battling against big pharma and folks with a lot of money, but we want to make sure that we are reasonable, and our goals are reasonable. We're looking at drugs that increase by the thousands each year, and that folks have to make choices of whether they take their medicine or feed their families or pay their rent, and we shouldn't have that here in America. So I'm just so fortunate that I've been able to join up with these folks, and they took time to come and hear from Harford Countyans. And trust me, this is really a policy issue that's going to go on for years. And as we build the affordability board and make it stronger, I'll make sure that we get them back up here to Harford County as soon as we get out of this pandemic, so I can share your stories and part of our beautiful county with the panel and with my colleagues. So God bless you. Thanks for listening. Touch base with me if you have any questions or concerns that you need me to get to the board. So Vinny, thank you all so much.
Thank you. Bye-bye.
Take care, everybody.